Hello and welcome to our video about the causes of halitosis. If you are suffering from the problem of bad breath, you should know the possible causes of halitosis. Some of the causes are mentioned below: dry mouth, alcohol consumption, diabetes, low-carb and high-fat diets, and poor oral hygiene. In addition, you should also know that mouth, nose, and throat infections can also lead to bad breath. The bacterial growth on the mucus produced by a sinus infection feeds on the bacteria that cause bad breath. Dry mouth. There are several reasons why you may experience dry mouth and halitosis. Whether it's constant, intermittent, or not at all, it's important to find the cause of the condition. Dry mouth is a symptom of a health issue, called xerostomia, in which the salivary glands in the mouth don't produce enough saliva to keep you healthy. Other causes include dehydration and stress, among others. Regardless of the cause of your halitosis, the only way to cure it is to treat the underlying condition. While breath mints are effective in masking the problem, they only hide the real problem. To find the root of your problem, visit a dentist or oral health care provider. You can get a treatment plan designed to meet your individual needs. As a preventative measure, you should brush your teeth twice a day for 2 minutes, floss once daily, and clean your tongue with a brush. Additionally, make sure to drink plenty of water to prevent dry mouth. Smoking is also a common cause of dry mouth and halitosis. Tobacco products are also a common cause of dry mouth, as they make you more prone to developing gum disease. Practicing good oral hygiene is a major way to reduce your risk of developing halitosis and cavities. Besides using antibacterial toothpaste and mouthwash, you should visit your dentist regularly. If you have a history of gum disease, a professional cleaning may be in order. Alcohol consumption. Studies have shown that alcohol consumption contributes to the growth of bad bacteria in the mouth. According to a study, mouths of heavy drinkers had more Neisseria bacteria, which produce the carcinogen acetaldehyde. Other bacteria that are associated with bad breath include lactobacillus, which are common in probiotics. In a recent study, researchers discovered that drinking beer or wine daily increased the levels of halitosis-causing bacteria in the mouth. The effects of alcohol on the breath can vary among individuals. Some people experience alcohol breath even after only one drink. This is known as delusional halitosis and is often accompanied by other mental health problems such as obsessive-compulsive disorder or hypochondria. To prevent bad breath caused by alcohol, people should limit their drinking and consult a doctor. However, alcohol-dependent people should seek treatment and not drink alcohol excessively. It is known that regular alcohol consumption can alter the bacteria in the mouth. It can weaken the immune system, which puts them at risk of infections. Other health risks associated with alcohol abuse include bad breath, tooth decay, and gum disease. Regular alcohol use can even increase the risk of oral cancer. It's important to realize that the effects of alcohol aren't immediately visible. Alcohol abuse can also affect the body's immune system, making it easier for bacteria to multiply. Diabetes. There are a number of different causes of halitosis, and the main factors determining if a person has a problem with breath odor are discussed below. Most halitosis cases are caused by oral conditions. However, many people develop halitosis as a result of systemic diseases, including stomach cancer and gastroesophageal reflux disease. Tonsil stones are calcified growths that form inside the enlarged tonsils. They appear as small, white lumps on each side of the throat. Aside from being unsightly, halitosis caused by tonsil stones is usually accompanied by sore throat, difficulty swallowing, and a bad taste in the back of the mouth. Some people are genetically predisposed to developing halitosis. For instance, individuals with large taste buds have a higher risk of developing halitosis. Some food sources of halitosis may be difficult to avoid. These include foods that produce foul smells. But the good news is that they are only temporary, and you can eliminate them with dietary changes. Eating foods with high fiber content, including whole grain products, will help to eliminate biofilm. Additionally, abrasive foods such as shredded wheat or grits will help remove any buildup of bacteria. Additionally, consuming berries and yogurt are a great way to combat halitosis, as they are naturally rich in vitamin C, which repels odor-causing bacteria. Low-carb, high-fat diets. People who follow a low-carb, high-fat diet often experience halitosis, a common problem caused by an excessive intake of proteins. Bacteria feed on protein particles in the mouth, releasing sulfur gases that give off a foul smell. In addition to causing halitosis, these diets cause the body to enter a metabolic state known as ketosis, where it uses fat to generate energy. Ketones are a byproduct of this process, and can cause a person to experience bad breath and general body odor. A low-carb diet causes the body to break down fats as its primary energy source. Because of this, it produces acetone, which is a common odor-causing compound. People on a ketogenic diet have bad breath because their body is unable to use glucose for energy. This leads to the production of acetone in the mouth. This odor is a sign of an underlying health problem, so it is essential to consult a dentist to ensure you do not develop keto breath. If you are suffering from bad breath due to a low-carb, high-fat diet, the best way to treat it is to increase your intake of carbohydrates. These carbohydrates will keep the body out of ketosis, which will prevent a bad breath from developing. Furthermore, if you are following a low-carb, high-fat diet, adding more healthy fats like nuts and seeds will help you overcome halitosis caused by ketones. Chest infections. The digestive system is a common cause of halitosis. As a result, a person's breath smells foul. Acid in the stomach causes the smell. Other causes of halitosis include respiratory infections, achalasia, GERD, and hiatal hernia. Surgical intervention for infected adenoids may also be necessary. Inflammation of the bronchial tube may also cause bad breath. The air sacs in the lungs become inflamed and filled with mucus and blood. These lungs also produce foul-smelling mucus. In some cases, people with bronchitis will have to visit a doctor for antibiotic treatment. They may also undergo breathing tests to monitor their condition. Once the infection has been determined, treatment will depend on the severity and progress of the condition. Symptoms. A professional diagnosis of halitosis is the best way to determine the source of this problem. In a halitosis case, you should be open and honest with the healthcare professional. The healthcare professional will need to understand your symptoms and health history to determine the underlying cause and recommend appropriate treatment. Listed below are a few possible causes of halitosis. For more information, consult your veterinarian. A common cause of halitosis is postnasal drainage, which is a thick mucus that drains from the nose. Postnasal drainage is a common result of allergies and sinus conditions, and can contribute to halitosis. However, this treatment is often ineffective and painful, and does not eliminate the odor caused by postnasal drainage. Even mild allergies can lead to a bad breath smell, but it's not an actual cause of halitosis. Other causes include acute tonsillitis, postnasal drip, and foreign bodies lodged in the throat and nasal passage. Another possible cause is atrophic rhinitis, a respiratory infection caused by bacteria. Diabetes and other conditions resulting in a dry mouth may cause a fishy smell. Sometimes, liver disease can lead to halitosis. The treatment will depend on the cause of your halitosis and the underlying cause. Treatment. The cause of halitosis can be a variety of issues. Some people have a genetic predisposition to it while others experience it because of poor oral hygiene. Whatever the case, there are many ways to treat halitosis, from changing your diet to reducing your alcohol intake. However, if you are suffering from halitosis, the right treatment will depend on the cause. Regular dental care can help eliminate foul breath and reduce the amount of bacteria in the mouth. Brushing your teeth at least twice a day and flossing can get rid of debris. Besides brushing, avoid wearing dentures and putting a straw in your mouth. Antibacterial mouthwash can also help. Also, quit smoking cigarettes and chewing tobacco. Symptoms of halitosis may be a sign of periodontal disease, so visit your dentist if you suspect that you are suffering from it. If your halitosis is caused by an internal problem, your family doctor should consider treating the problem. Generally, bad breath is an effect of dental problems. However, bad breath can also be caused by external issues, such as gum disease or diabetes. If you are concerned that your bad breath is a result of a medical problem, you should consult a specialist. In addition to the oral cavity, you should visit your dentist for more effective treatment options. We are so grateful that you stayed to the end.